We are back here at Performance Medicine in Kingsport talking today about something that's part of our diet that may have gotten a bad rap. We're talking a little bit about salt and some of the myths surrounding salt. We're here with our daytime doc, Dr. Tom Rogers. Thanks for having us out today.
Thank you.
You always have these interesting topics, and today you've got me thinking about salt, which of course I was immediately like, oh, salt is bad. And you said that's actually not the case.
I know. I think we've overdone the restricting of salt. A lot of it depends on what kind of salt you're eating, but as we talked about earlier, I mean, you think about salt as being a very good thing. Salt of the earth. Mm-hmm. The word salt, or the word salary, really comes from salt. Back in the Roman Empire, they measured your salary in salt. And so there's a lot of good sayings about salt, but it's gotten a bad name in the last few years because we've thought that it caused high blood pressure as well as cardiovascular disease. Well, it turns out if you really do your research and look into it, it's not all that bad. In fact, a lot of us are depleted of salt.
So what's happened is over the years, salt has changed, and now there's different types of salt.
Well, it's a complex matter, and even as a physician for 30 years, I've kind of changed my attitude towards it through the years. But you see these people coming into your office that are on 3 blood pressure medicines, and their blood pressure's still high. And you ask them about salt and say, yeah, I've been restricting my salt for years. Really, only a very few percentage of people's blood pressure is affected by salt. Salt you think of as a good thing because they started adding iodine into it back in the 50, 60 years ago, and it got rid of all the goiters. Mm-hmm. So in that manner, it was good. In the last few years, we've thought that salt caused hypertension and cardiovascular disease, but it turns out that a lot of that depends on the type of salt you eat. And now, so everybody's going to sea salt, which has no iodine in it. We're seeing more goiters. We're seeing a lot more thyroid disease. So iodine plays an important part. But the tricky thing is, which salt should you eat? Should you eat iodized table salt,
right,
which has the iodine, or should you eat Himalayan or Celtic or sea salt? After a lot of research on this and treating patients, treating myself, I really believe that eating the right kind of salt can decrease your blood pressure, not increase it. My choice is a Celtic salt. It's a sea salt that's unrefined, meaning they don't strip all the other minerals out of it, like zinc and selenium and magnesium, which will lower your blood pressure. But there's many, many minerals that they've stripped out of table salt. So I don't recommend table salt. I recommend Celtic sea salt. Watch what happens with your blood pressure.
So you said it's kind of a grayish color.
Kind of a grayish color. A lot of people eat the Himalayan pink sea salt, but there's some reports of that it may have some undesirable things in it too. So I prefer the Celtic. Now, the other thing is that 96% of us are deficient in iodine.
Okay.
So.
And there's a difference.
There's a difference. Now, and what I do in my practice, I don't indiscriminately put somebody on iodine. I always do a urine test to see if they have low levels of iodine. I find so many people having thyroid disease, and one reason is because they don't have enough iodine in their diet. Iodine, 100 years ago, that was the most commonly used drug in a pharmacy, was just iodine, because think about it, it's an antibacterial,
sure,
it's an antifungal. Lack of iodine is the leading cause of mental retardation in the world. And you don't see the goiters, but people are still very deficient in iodine. A lot of people think it's linked to higher rates of autism and ADD that we see now. So iodine is very important. So you need to find somebody who can look at your iodine levels.
Check your iodine level, check your salt and the kind of salt that you're using, and you recommend the Celtic salt.
I recommend the Celtic salt and checking your iodine levels.
Switch out my salt. Great topic. Thank you so much for having us out.
Thank you.
For more information, you can always check out their website, performancemedicine.net.